Venous leg ulcer is a type of chronic wound that occurs primarily in the lower legs, typically around the ankle, as a result of chronic venous insufficiency (CVA). This condition arises when the veins in the legs are not functioning properly, leading to poor circulation, which causes blood to pool in the veins and puts pressure on the skin. This pressure can damage the skin and tissues, leading to the formation of an ulcer. Causes of venous leg ulcers. Venous leg ulcers are usually caused by chronic venous insufficiency (CVA), a condition in which the veins in the legs fail to effectively return blood to the heart. Several factors contribute to CVA and the development of venous ulcers. Venous reflux. This occurs when the valves inside the veins become weakened or damaged, causing blood to flow backward and pool in the veins instead of flowing upward to the heart. Varicose veins. Enlarged and twisted veins increase the likelihood of developing CVA and venous ulcers. Deep vein thrombosis. DVT, a previous blood clot in the deep veins of the legs, can damage the vein valves, leading to venous insufficiency and ulcer formation. Obesity. Extra weight increases pressure on the veins in the legs, contributing to poor circulation and CVA. Age. The condition becomes more common as people age, as the veins lose elasticity and the valves become less effective. Inactivity. A sedentary lifestyle or prolonged periods of standing or sitting can contribute to poor circulation and venous pressure, increasing the risk of developing ulcers. Pregnancy. Hormonal changes and increased pressure on the veins during pregnancy can lead to CVA and the formation of ulcers. Symptoms of venous leg ulcers. The symptoms of venous leg ulcers may vary, but they typically include open sores or wounds. The most prominent feature is the development of a wound on the lower leg, particularly around the ankle, that does not heal or heals slowly. These ulcers often have irregular, jagged edges and are shallow in appearance. Pain or discomfort. Venous ulcers can be painful, and the pain may worsen with standing or walking. The pain may be relieved when the legs are elevated. Swelling. Swelling in the affected leg or around the ulcer is common, especially in the lower legs and ankles. The swelling is typically more pronounced later in the day. Red or inflamed skin. The skin around the ulcer may become red, inflamed, or hardened. Discoloration of the skin. Skin in the area surrounding the ulcer may darken or become brownish in color due to the leakage of blood cells and iron hemosiderin staining. Itching or discomfort. The skin around the ulcer may become itchy or uncomfortable, leading to irritation. Fluid leakage. The ulcer may produce clear or yellowish fluid exudate, especially if it is infected or has become chronic. Signs of infection. Infected ulcers may become red, swollen, and painful, and may produce pus or foul-smelling discharge. Fever or increased pain can indicate infection. Risk factors for venous leg ulcers. Several factors increase the risk of developing venous leg ulcers, including chronic venous insufficiency, the primary cause of venous leg ulcers, often due to damaged or weakened vein valves. Varicose veins. People with varicose veins are at a higher risk. History of deep vein thrombosis. DVT, previous blood clots in the veins, can lead to venous insufficiency and subsequent ulcer formation. Obesity. Excess weight increases pressure on the veins, making it harder for blood to return to the heart. Sedentary lifestyle. Lack of movement can impair circulation, contributing to the development of venous ulcers. Age. The risk of developing venous leg ulcers increases with age. Inactivity or prolonged standing. Jobs or activities that involve standing or sitting for extended periods can increase the risk. Family history. The family history of venous diseases can increase the likelihood of developing CVA and venous ulcers. Pregnancy. Pregnancy can increase the risk due to hormonal changes and increased pressure on the veins. Diagnosis of venous leg ulcers. A doctor will typically diagnose venous leg ulcers based on the appearance of the wound and a physical examination. Additional tests may be performed to assess blood flow and determine the underlying cause of the ulcer. Physical examination. The doctor will inspect the ulcer, as well as the skin around it, to look for signs of venous insufficiency, e.g., varicose veins, swelling, discoloration. Doppler ultrasound. This non-invasive test uses sound waves to assess blood flow in the veins and detect any abnormalities, such as venous reflux or deep vein thrombosis. Ankle brachial index ABI. This test compares blood pressure in the ankle to that in the arm to assess the overall circulation in the legs and identify any arterial blockages that could complicate ulcer healing. Treatment of venous leg ulcers. Treatment for venous leg ulcers focuses on managing the underlying venous insufficiency, promoting healing of the ulcer, and preventing infection. Key treatment strategies include compression therapy. Compression bandages or stockings are the cornerstone of treatment for venous ulcers. They help improve circulation by applying controlled pressure to the legs, which reduces swelling and prevents blood from pooling in the veins. Compression helps promote healing and prevents new ulcers from forming. The pressure applied by compression garments needs to be carefully managed and monitored by a healthcare provider to avoid complications. Wound care. Cleaning and dressing the ulcer. The ulcer should be cleaned with a mild antiseptic and covered with appropriate dressings to protect it and absorb excess fluid. Dressings help create an optimal environment for wound healing and reduce the risk of infection. Debridement. If the ulcer has dead tissue or excessive slough, the healthcare provider may perform debridement, which involves removing dead tissue to promote healing. Elevating the legs. Elevating the affected leg above the level of the heart can help reduce swelling and improve circulation, which is essential for the healing of venous ulcers. Leg elevation should be done regularly throughout the day, particularly when resting. Medications. Topical treatments. Topical antibiotics or antimicrobial ointments may be prescribed if there is an infection. Pain relief. Non-steroidal anti-inflammatory drugs and SAIDs or other pain relievers may be recommended to manage pain associated with the ulcer. Venous medications. Some medications, like flavonoids e.g., diosmin, may help improve venous tone and circulation, potentially aiding in ulcer healing. Surgical treatments. If the ulcer does not heal with conservative measures, surgery may be needed to address underlying venous insufficiency. Surgical options include vein stripping or ligation. The affected veins may be surgically removed or tied off to improve blood flow. Venous laser treatment (EVLT), a minimally invasive procedure that uses laser energy to close off damaged veins. Sclerotherapy. A solution is injected into the vein to cause it to collapse and seal off. Prevention of recurrence. Once the ulcer has healed, continued compression therapy and lifestyle changes such as regular walking, weight management, and leg elevation are important to reduce the risk of recurrence. Prevention of venous leg ulcers. While it may not be possible to prevent venous leg ulcers in individuals with chronic venous insufficiency, there are several strategies to help reduce the risk. Compression therapy. Wearing compression stockings or bandages can help prevent blood from pooling in the veins and reduce the risk of ulcers forming. Regular exercise. Physical activity, particularly walking, can improve circulation and reduce venous pressure. Elevate your legs. Elevating the legs, particularly after standing for long periods, can reduce swelling and improve circulation. Avoid prolonged standing or sitting. Try to move around regularly to help blood circulate more efficiently in the legs. Maintain a healthy weight. Reducing excess weight can help reduce pressure on the veins and improve circulation. Skin care. Proper skin care can help protect against infection and promote healing, especially if you are prone to venous ulcers. Prognosis. With appropriate treatment, most venous leg ulcers can heal over time. However, the healing process can take weeks or even months, depending on the severity of the ulcer and the underlying venous condition. It's important to follow a treatment plan that includes compression therapy, wound care, and lifestyle changes to prevent recurrence and ensure optimal healing. In some cases, Venous ulcers can become chronic and may recur over time, especially if the underlying venous insufficiency is not managed effectively. Regular monitoring and continued treatment are essential to prevent complications and promote long-term healing. If you're someone you know has a venous leg ulcer, it's important to seek medical attention to develop a comprehensive treatment plan and manage the underlying venous health